All right, this morning we are happy to welcome MyCare Medical back to the show. As you may already know, they specialize in caring for older adults as their goal is to keep them healthy and transition them to healthy, active seniors. And this morning we're going to focus on the topic of hypertension. What is it, right? Well, Dr. Jose Lebron Perez and Gigi Sanchez are back to explain. Good morning. Welcome back.
Good morning.
So yeah, let's talk about hypertension. I feel like it's one of those words and things that you hear a lot about, but maybe you don't fully understand. So explain, doctor, what it is first. How do you explain what hypertension is?
Hypertension, as I define, is an elevation of the arterial blood pressure.
Okay.
This elevation may be caused by different issues, like the small arteries are the ones who control, they regulate the blood pressure. They can get stiffer. You can increase the resistance of the system or an increase in the cardiac output.
Okay. So what are symptoms? How do you know that you were struggling with hypertension and it needs to be looked at, for people watching this morning? What are some red flags?
So it's really complicated because they don't have any specific symptoms. So it can be silent. You can have high blood pressure and you never know that you have it. But if you have some symptoms, you're going to have headaches, you're going to have dizziness, blurry vision, flush, you're going to have that pressure on yourself. So that's going to make you feel uncomfortable. When you have those symptoms, you have to really work it through quickly. It can be catastrophic for CVA, strokes, and heart condition, damage of the kidneys or the eyes. So we have to quickly, when we have the symptoms, go talk to your doctor quickly.
Well, and that was what my next question was going to be. Just make sure you're communicating with your doctor as you
Really
should.
important.
What are some of the treatments then if you are diagnosed with this?
When we diagnose the hypertension, what we're going to do is measure the blood pressure. We search about 130/80 when the machine on the sphygmomanometer. That will give us a pre-hypertension, and 140/90 for hypertension. We have to make changes in our lifestyle. Stop smoking, decrease the amount of sodium or salt in our food, exercise, sleep well to relax. Alcohol consumption has to be moderate too, so we can improve. After that, if we don't get an improvement, we have to start taking medication. Water pills to decrease the cardiac output, and sometimes we have to use multiple medications, 2, 3, 4, we can control the blood pressure.
Yeah. You know what I love about your team too is how you were able to speak to the Spanish-speaking people as well. I know we have a lot of viewers watching this morning as well, and you wanted to mention this in Spanish too.
Sí, queremos acordar a los pacientes que estamos para cuidarlos mucho. La hipertensión es un tema bien importante. Hay que controlar la sal en los alimentos y estar siempre consciente de que verá la presión y a su doctora, a su médico primario, para que estemos siempre sanos y saludables.
All right, awesome. Thank you, Doctor. Gigi, let's talk about the practice a little bit and kind of what makes your team so special.
Sure.
Other than this, what we, I think that's a huge point.
It's a huge point. At MyCare Medical, we treat our patients as family. The thing that we like the most is that we train our doctors to coordinate care not only in our clinics but outside the clinics. Right now, we're open enrollment, and it's a lot of people that have a lot of questions about Medicare and their benefits. You can call our number, you can go to our website, and we can schedule a visit, and we can help you with that as well. Okay, we care about our patient, and we care about the transition from, older adults to senior citizens, and they have to be happy, they have to be healthy, they have to be able to enjoy even now the holidays with their family without worrying about that they're going to end up in a hospital or anything like that.
I know. Well, just a couple seconds left. Anything that we left out? What's your take home for people watching this morning?
Okay. Don't be afraid, right?
We just want to let them know that we're there to help them. We treat them as family. Give us a chance to explain, to be part of your health team. We like to work together. When the patient understands what we're going on, they really appreciate it, and we can help them in a really good way.
I love that. Thank you both so much for your time this morning. We're going to put up details on how you can get in touch with MyCare Medical Group. Again, offices all over the Bay Area. So again, we appreciate your time. We look forward to seeing you both soon.
Thank you very much.
Thank you very much.